So Curvy is a meat trade survivor from Thailand, and she has a pretty substantial neurological issue. We're not really sure yet what it is. That's why she has a movement disorder, is what we think, where she actually curves her body into a C shape, and then she'll have a seizure in her back legs. She is extremely fearful of people, so it makes handling her a little bit more difficult.
Well, there's a reason she's fearful of people,
absolutely.
Right? Where did she live? You said it was like the prison camps.
Well, yeah, the torture camps.
Right.
Yeah, exactly. So when she was in the
where was she from originally?
Originally, she is from, she was saved from the meat trade industry in Thailand, and she was brought to Buriram, which is the first shelter that they go to when they're rescued from the meat trade. It's a very large shelter where they're housed with a couple hundred dogs in each run. From there, once they have a rescue commitment, so once I committed to her, then she was brought down to Phuket, which is it's a much smaller shelter, so there's only maybe 30 to 40 dogs in each run. And that's where they get all their vet care. That's where they start getting handled. They start working on leash work in preparation to go to their rescue, wherever it is around the world. On this episode of Vet Rescue, we're going to tell you about Kirby.
Energize, realize, feels so good just to be alive. Time's a gift, my time is free. I can spend it on you, you can spend it on me. I can say you'll be blown away by the change you see me. And I feel alright, dance all night, put a little flavor in my life. I put the good stuff in.
I have a very special edition of Vet Rescue for everybody today. We're going to be reporting from Michigan State University's Small Animal Clinic.
I'm Dr. Catherine Winger. I'm one of the neurologists here at MSU. So Curvy is here today because she's having these episodes. So in between them, she's very neurologically normal, but at the time of the episodes, which are happening several times per day, she starts to curl her body to one side and also lifts up her left hind limb. So based on the appearance of the episodes, we're strongly considering two different processes. One could be a focal seizure. So that's a seizure that's originating just from one very specific part of the brain. In this case, it would be the part of the brain where it's supplying the information down to the left hind leg. Or she could have a movement disorder, what we would call paroxysmal dyskinesia. It can be really difficult to tell the difference between these two conditions. And both of them can be either idiopathic, meaning there's no specific underlying cause, or secondary to some structural disease within the brain. So for that reason, we're going to look inside the brain, which requires an MRI. And unfortunately, in our patients, that means going under general anesthesia. So we can actually take a look at the structure of the brain and see if there are any abnormalities there. We likely will also be doing a spinal tap afterwards, which helps us look at the fluid surrounding the brain for any microscopic changes that could suggest inflammation or infection. Mm-hmm. All right, so MRI allows us to kind of generate this 3D reconstruction of the soft tissue structures, in this case in Kirby's head. So we acquire them in three different planes. So this view is a sagittal image. So her nose would be up off the screen here. This is, of course, the brain that we're going to be interested in looking at, and her neck would be out on the right side. This is going to be our transverse images. So it's as if we've sliced her like a loaf of bread and we're looking at it face on. And we acquired sequences that have a few different properties that help us take advantage of essentially the amount of water that's in a tissue that gives each tissue its different sort of shade of gray or white. So on this type of a sequence, a T2-weighted image, anything that's very fluid or very fatty is going to be really bright white. Mm-hmm. And so we can look both for changes in either the color or intensity of a structure, and also, fortunately, since the brain has two halves, we can look for any kind of asymmetry. So we're going to look, in her case especially, for any kind of malformation, anything that would suggest she had a trauma, any kind of infection or inflammatory process. And fortunately, her MRI looks very normal. So as we scroll through, we can see nice definition on both halves of the brain. The cerebrum, or the front part of the brain, is generally where seizures originate. So that was one area of interest for us. And then also for the movement disorders, some of them originate from either the motor cortex, which again is up at the front part of the brain here, or from the motor centers in the brainstem, which are going to be down here. So those were some of the main areas that we were looking at in Kirby's case. So everything looks very normal. What we can see here that's really bright white is going to be her cerebrospinal fluid. So that's produced in the ventricles, these bigger fluid spaces in the middle of the brain. And then it flows out and it goes around the brain and also down and around the spinal cord. So here we can see everything looks very symmetrical. There's nothing brighter or darker than it should normally be. We use some other sequences to look for other changes in the fluid, anything to suggest hemorrhage or bleeding. And then we also give an injection of a contrast agent. And if there's any disease affecting the barrier between the bloodstream and the brain, so anything that causes inflammation, infection, cancers, those things will often contrast enhance or become much brighter after that injection. And so in her case, we also did not see any abnormal contrast enhancement, which is good news. So since the MRI mostly looks for gross structural disease, we also like to look on more of a microscopic level. We're a little limited with what we can actually sample in our patients, but so the spinal fluid, since it's closely associated with the brain, is an easy sample to obtain. So we did take a sample from the back part of the skull here, and that will go to our pathologist for analysis, and we'll have those results probably by tomorrow.
Curvy's just, she's a fascinating case because it's, again, the medical always gets me. I'm fascinated by medical, but it's a great learning experience for everybody all around, to take a dog like this, because again, we don't know what she experienced when she was in the meat trade, but she's, she definitely deserves that second chance, and she deserves a chance to, for us to figure out health-wise what's going on with her, and then also just to give her that chance of learning to trust, because obviously she doesn't trust people. She has a great fear of people, so just giving her that chance, she might be with me for the rest of her life. I don't know, she might be one that never gets to be adoptable, whether it's because of her medical issues or because of her behavioral, because of her fear of people. But she still deserves that chance, whether or not she chooses the right choices or not, that's up to her, but we need to give her those choices. So they're worth it, they're definitely worth giving that second chance to. And again, she can educate so many people. Just, all the students, all the doctors, on educating, the experiences they're getting just dealing with her issues, because it's not a normal issue.
Well, that's the thing. You guys may not really ultimately find out what's wrong with this dog.
No, we might not. No, very, very real possibility.
What's your objective? Are you really trying to make this like a different dog? This is not My Fair Lady. You're not looking to change this dog into something that it's not.
No, and that's when, again, so whenever you're rescuing a dog, it doesn't matter from the meat trade or you're taking it off the streets of Detroit, you have to ask yourself, what is our goal for this dog? Obviously, my goal for this dog is not to be a dog park dog. She's not going to be that dog that goes to the dog park, that, that super social, super happy, I'm going to go to the kids' softball game or Little League game. That's not going to be her. That's not my goal for her. If that was my goal, I'm setting myself and her up to fail. My goal for her is to be able to bond with a few people and for her to live a good quality of life where she's not in fear. So that's my goal. My expectations for her are very low, as with any of our fear dogs that we bring in. So just to be able to get them so they can trust people, so they understand that we're not all bad, and that can give them a good quality of life.
You're here because you love animals. Help save a life today. Your donation will send the World Animal Awareness Society team on our next mission. From all of us here at the World Animal Awareness Society and WA2S Films, thank you for watching Vet Rescue. We'll see you next time. It's an animal world out there. Watch the World Animal Awareness Society channel and feel right at home. Come, sit, subscribe, and stay a while.